In today's talk, we will be reviewing the interaction between diabetes and exercise. We will be discussing the possible changes in your blood sugars when exercising, knowing your personal low sugar risk when it comes to exercise, and how to monitor your blood sugars following your exercise routine. Now, we know that if someone has a higher fitness level, they will have better sugar control, and they will also have a lower risk of cardiovascular disease. Now, you are cardiac patients, so some of you may have had a heart attack or a stent or a bypass. So we are trying to increase your fitness in order to also manage your blood sugars. But of course, it is a balance, as we must do it safely, because we also have to think about your cardiac history. Please bear in mind whenever we are progressing your exercise. Talk to your exercise therapist in regards to the interaction between exercise and cardiovascular risk and also diabetes management. Now, it is very important to know what your own personal hypoglycemic or low blood sugar risk is. Now, for most of you, going low in your blood sugars to the point where it is actually called hypoglycemia is very low in risk. There are some things you should know in order to determine if you truly have a risk of going low in your blood sugars. Number one would be, are you on insulin? And more importantly, are you on insulin before meals, specifically for the reason of that meal? If that is the case, then you are definitely at a higher risk of going low in your blood sugars. This doesn't mean that you are going to go low. It just means that you have to prepare yourself. For example, you want to make sure that you're eating the right amount of meal with the right amount of insulin. And when you are exercising, you want to be checking your blood sugars afterwards to make sure that you haven't gone low. If your sugars have decreased, but in a normal fashion, as it's supposed to be, as exercise is supposed to decrease your blood sugars, but you have not gone low, then you're okay. You can continue exercising at the same rate, eating the same type of food with the same amount of insulin. But if you've gone low, meaning hypoglycemia, as we have defined it before, with a reading of under 4, with symptoms or no symptoms, then you should definitely be following up with your diabetes care provider. There may need to be an adjustment in your insulin or perhaps in the way you're eating. Another factor that may increase your risk is if you have frailty. Now, frailty for the most part happens in the elderly, but it can happen in younger individuals as well, but the vast majority will be elderly. And frailty just means someone who has been losing weight, quite a bit of it in the past few months, has difficulty walking, has low energy, and so forth. These individuals, if you are thinner, if you are frail, you are at a higher risk of going low in your blood sugar. And also the last factor would be what your kidney function is. Now, if your kidneys are normal, so you've gone for blood work and there is no kidney disease, then you have nothing to worry about. But when it comes to your kidneys, you have to remember that insulin, for example, and other diabetes medications, they got to go through your kidneys, whatever's left over, and it has to be excreted. So if your kidneys are not working as well, these medications and insulin can accumulate, and therefore there could be the potential of you going low in your blood sugar. Okay, so please do talk to your diabetes care provider in regards to your kidney function. Are my kidneys all right? They most likely probably are okay, but make sure that you review that with them. Now, we have spoken that for the most part, exercise is going to be decreasing your blood sugars for the long term and even from day to day. And this is true, but there are some exceptions. If some of you are exercising at high intensity exercises, which in cardiac rehab, we don't really recommend at this moment in time, but if you are, and you are on insulin, then you could have a spike in blood sugars. So what type of exercises are we talking about? We're talking about very intense exercise. We're talking about sprinting, whether it's running or perhaps very fast sprinting when it comes to ice skating, doing very intense resistance training. You could potentially have a spike in blood sugars that hours later will be dropping, which then you would have to be very careful in regards to not going low. Now, for the most part, this is not most of you, but only for the select few that may be exercising at very high intense exercises who are on insulin. If you are one of these individuals, please do follow up with your diabetes care provider. Other factors that could potentially reduce your blood sugars during exercise, after exercise, are as follows. I already spoke about insulin. Be aware of what type of insulin you are using. Some have a higher risk than others when it comes to someone going low on their blood sugars. So please consult with your diabetes care provider. Make sure you let them know that you are starting an exercise program. I'm sure they'll be very pleased with that. Another factor would be weight loss. If you notice you start losing weight and you are on insulin, make sure you have extra care in regards to monitoring your blood sugars. If you start noticing that your blood sugars start decreasing, not to the point where you've gone low, but you see a pattern where your blood sugars are decreasing more than previously with the same amount of insulin, and yet your meals are the same, then make sure you follow up with your diabetes care provider. Weight loss can increase insulin sensitivity, and therefore your sugars can get lower. Another factor, I know that as in cardiac rehab, we usually say that it doesn't really matter what time you exercise when it comes to just getting exercise done. But in regards to someone with diabetes, if you are on insulin, please be aware of the time management, specifically if you are taking insulin with meals. It would be a good way to review with your diabetes care provider what to expect and when would be a good time to check your blood sugars during exercise or after exercise. But timing does matter for someone who is on insulin. Another factor is how hot it is, whether it's outside or indoors. Heat can actually make your blood sugars decrease. Your insulin will be accelerated that way. Even if you're in a hot sauna, which we do not recommend, or even a massage, because heat is being applied by the touch of someone else. So just be careful. If it is hot outside, monitor your blood sugars more closely. You may notice they may start dipping a bit more than usual. Staying hydrated is very important. The more water you are losing, the higher the concentration of sugars are in your bloodstream. So therefore, they may actually appear higher. So make sure that you do drink plenty of liquids as you are exercising. Now, for the most part, even if your blood sugars are elevated, you should still be exercising, because rule of thumb is exercise will decrease your blood sugars. But of course, what is too high? Well, there's no exact number, but definitely if you are going over a reading of, let's say, 15, 16, and if you are experiencing symptoms such as feeling very fatigued, blurry eye vision, nausea, headache, very thirsty, then the recommendation is to not exercise that day. It's best to bring those sugars down. If you're on insulin, consult with your diabetes care provider. Here we have Fatima, who just started a walking program. She rapidly increased her walk duration from 20 minutes to 2 hours, walking at a medium walking pace. Fatima enjoys walking in the morning. She is on Lantus insulin at bedtime. Could there be any precautions that she should be taking? Now, one of the first things we should observe is that she increased her walking very rapidly, from 20 minutes to 2 hours. She is exercising at what's called medium intensity, which we know can decrease blood sugars during the exercise and after exercise. Now, she enjoys walking in the morning. It doesn't say here if she has eaten her breakfast first or not, and we know that she is on insulin at bedtime. Now, the insulin she is on, which is called Lantus, is one of those types of insulin that has a lower risk of someone going low on their blood sugars. Nonetheless, there is still a risk. And therefore, she will need to see what her blood sugar response is after the exercise in the morning. If she starts noticing her sugars are dipping low, she may need to inquire with her diabetes care provider to perhaps reduce the Lantus the night before, or maybe eat a bit more in regards to her breakfast. Regardless, you still want to be managing your blood sugars from day to day and following up with your diabetes care provider if you see any dipping of blood sugars. Here we see Frank. He wants to progress his exercise to include high intensity running and incline walking on a treadmill. He also wants to increase the intensity of his resistance training. He is on metformin only. Now, Frank is at low risk when it comes to going low on his blood sugars. He's only on metformin. But how would this change if he was on multiple insulin injections? Remember, in previous slides, we spoke about high intensity training, that this could actually spike someone's blood sugars during the actual exercise routine and afterwards. And if someone is on insulin, they have to be very careful they don't go low, because later on, these individuals' blood sugar will dip hours after these intense training sessions. So Frank is going to need to, if he is in multiple insulin injections, be very careful in monitoring his blood sugars afterwards to make sure he doesn't go low. If he does, or he comes close to it, he may need to go back and talk to his diabetes care provider in regards to perhaps reducing insulin or having a snack after his exercise and so forth. A few recommendations. Number one is what's called blood glucose or blood sugar pattern management. Now, when you start exercising, you will be increasing the duration of your exercise, the intensity of your exercise, but it's going to come a time where you're going to plateau and your exercise will pretty much stay the same. Now, this is the great best thing to be in if you have diabetes, because then you can predict what your blood sugars will be like after exercise, specifically if you're on insulin, because you know exactly how much amount of exercise you'll be doing, for how long, the intensity, even the temperature if it's indoors, and also at what time of day. Therefore, having the ability for you to make changes if you need to, based on the predictability of what your exercise will be. Number two, make sure you continue to monitor your blood sugars with whatever device you are using. Always carry Dexfor tablets if you're on insulin. And of course, make sure you follow up with your diabetes care provider in regards to your diabetes from day to day. Make sure that you try and aim to exercise the same time of the day if possible. This goes in hand with the blood glucose pattern management that we talk about. Your take-home messages are: remember, sedentary behavior is associated with adverse health outcomes. Know your own personal low blood sugar, or what is called hypoglycemic risk with exercise. Don't fear hypoglycemia, but instead prepare. If you're on insulin, talk to your diabetes care provider. Let them know that you're going to be adding exercise to your diabetes management. Listen to their advice in order to prepare and therefore aim to lower your risk of going low in your blood sugar. Remember, maximizing your fitness will have a better outcome for both your cardiac health and your diabetes. Thank you. It has been a pleasure serving you.